Okay, hello, and welcome to Creating a Culture of Compliance. My name is Lance King, and I am the Vice President of Sales within our culture at Healthcare Compliance Solutions. And today I will be presenting and will answer any questions following the presentation. And here is my contact information you can jot down real quick. Now, this presentation will address HIPAA, OSHA, Medicare, HR, and audit planning in the following format. It's important to note that the objective of this presentation is to assist practice administrators in creating a culture of compliance. Now, this will involve leaders to understand the regulations and how to implement them adequately and effectively. And we realize you're very limited in the time you can allot for a compliance program. And I think this presentation will provide a sound framework of how you can move forward. Note that it's not a complete training on any one healthcare standard in its entirety. And so further recommendations can be provided should you request assistance. Now, to start off, I want to illustrate the first section with a video. So make sure you have your sound on. And a couple of things to note about this. First, compliance can be compared to a 200-pound gorilla. Compliance isn't the most popular topic, but it is the law, and we do our best to help practices comply. Second, following the basketballs can be compared to having a focus that is an acute focus on a specific task. Now, we tend to overestimate our ability to do several tasks at once while thinking we're also any surprises or other details that may surface during that task. Would you agree? And so the question is, what are we doing while handling patient information? And what are the implications on other people if we aren't focused on one thing at a time? Again, you might agree that we all have an inflated impression on how we focus on things that are important. Now, moving on, this is a very important topic, creating a culture of privacy and security. This is one of the biggest challenges that is facing healthcare providers and business associates today. And privacy and security, we would argue, are best achieved when the overall atmosphere in the offices emphasizing confidentiality and of patient information. And so the leaders that really set the tone in creating this culture are going to do three things. The first is consistently communicate your expectations that all members of your workforce protect patient health information. The next is to guide your staff as leaders, to guide them on how to comply with, how to implement, and then enforce your privacy and security policies and procedures. Lastly, remind staff why keeping health information confidential is important. to patients and to your practice as well. This should be something that you do in staff meetings as well as when an opportunity to instruct presents itself. And that happens more often than not. Again, it's about understanding the compliance standards so that you can identify with how to help your team. So first, what is HIPAA? Well, as we probably all know, HIPAA is Health Insurance Portability and Accountability Act. Now, it's very common that practices are worried about having a HIPAA breach. And so what does that look like? Well, suppose a member of your office staff just accidentally mailed out the appointment list for the day containing patient names, dates of birth, social security numbers, and phone numbers to another patient along with their new patient packet. What do you do in this circumstance? Few questions. Does your staff know who to go to for leadership when there is a HIPAA breach? Does your designated HIPAA compliance officer know all the necessary steps to take in breach notification? Last question. Does your HIPAA compliance officer know where to receive guidance? These are things that are paramount and absolutely should be taken into consideration. Congress has created extensive breach notification requirements as part of the HITECH Act. And so after a breach is discovered, the provider must do some specific things. And you'll want to take notes on this. There are 6 specific things that happens pretty regularly. So you'll provide notification to each individual whose PHI was breached within 60 days. And the notification includes a brief description of what happened, date of breach, and date of discovery. Next, a description of the type of PHI involved and the steps the individual should take to protect themselves from any potential harm. Next, a brief description of what the office is going to do to investigate, mitigate losses, and protect against future breaches. In this, you should include contact information for individuals to ask questions or obtain additional information. Next, provide written notification via first-class mail or email if that is the preferred method of communication. And then the last 2 things to consider: you'll need to notify prominent media outlets when the breach involves PHI of 500 or more individuals, and then report all breaches to the Secretary of Health and Human Services. And this is required with all breaches. Again, all breaches should be reported. So make sure that you understand them so that you're not blindsided should an auditor come in and extend a finding or a fine. And again, your awareness, it's king in this effort. Next is identifying a breach. So a breach is generally an impermissible use or disclosure under the privacy rule that compromises the security or the privacy of protected health information. HHS's definition of a breach is, quote, an impermissible use or disclosure of protected health information is presumed to be breach unless the covered entity or business associate, as applicable, demonstrate that there is low probability that the protected health information has been compromised based on a risk assessment of at least the following factors. Take a minute to go through these 4 factors. The nature and extent of the protected health information involved, including the types of identifiers and the likelihood of re-identification. The second is the unauthorized person who used the protected health information or whom the disclosure was made. Next, whether the protected health information was actually acquired or viewed. And then finally, the extent to which the risk to the protected health information has been mitigated. And covered entities and business associates, where applicable, you have discretion to provide the required breach notifications following, as it says, an impermissible use or disclosure without performing a risk assessment, and that's to determine the probability that the protected health information has been compromised. So please note that. There are 3 exceptions to the definition of breach. The first exception applies to the unintentional acquisition, access, or use of protected health information by a workforce member or person acting under the authority of a covered entity or business associate if such acquisition, access, or use was made in good faith and within the scope of authority. Number 2, the second exception applies to the inadvertent disclosure of protected health information by a person authorized to access protected health information at a covered entity or business associate to another person authorized to access protected health information at the covered entity or business associate, or organized healthcare arrangement in which the covered entity participates. And in both cases, the information cannot be further used or disclosed in a manner that's not permitted by the privacy rule. The third exception applies if the covered entity or business associate has a good faith belief that the unauthorized person to whom the impermissible disclosure was made would not have been able to retain the information. So these are 3 very important exceptions to a breach. So some key components of the HIPAA privacy rule, some HIPAA protections. We'll go through these pretty quickly. First, we'll actually go through about 9. First is to help ensure the privacy of protected health information. Next, give patients more control over their health information. Establish appropriate safeguards that healthcare providers and others must achieve to protect the privacy of health information. Hold violators accountable, and that's with civil and criminal penalties that can be imposed if they violate patients' privacy rights. The fifth one is to strike a balance when public responsibility supports disclosure of some forms of data, for example, to protect public health. Enable patients to find out how their information may be used and about certain disclosures of their information that have been made. Limit release of information to the minimum reasonably needed. Give patients the right to examine and obtain a copy of their own health records. And lastly, empower individuals to control certain uses and disclosures of their health information. And that last one kind of encapsulates this slide. So the HIPAA protections, the HIPAA security rule puts into place 3 things: physical, technical, and administrative measures to protect patients' health records. The second is focus on internal and external security threats. And this includes breaking through network firewalls, email attacks through interception or viruses, compromise of passwords, and computer viruses. The third is assessment of and preparations for security risks in hardware, software, facility, and environment. And at this point, you may feel that you're going to have to conform to every detail within these healthcare regulations. Don't worry. I'll share some recommendations that will provide some flexibility and help further clarify your boundaries. So 7 steps. The first, understand the rules. Review the regulations and learn about HIPAA. That's the bottom line. Second is assign responsibility. Appoint a compliance officer. Again, you're doing so much already as practice administrators. If you can, assign this responsibility. And then list created of your EPHI and identify your information systems. Number 4, conduct a risk analysis where you'll assess vulnerabilities, prioritize your risks, and then identify your security measures. Number 5, implement policies and procedures. And this requires you to document all policies and procedures, document methods to address the security policies, and select security controls that match your policies. Deliver a compliance training program. And this means you'll train all employees, including doctors, and document the training. And this should be an ongoing training process, not just a once a year. Auditors want to see ongoing training that's documented. And then 7, monitor and document ongoing HIPAA progress and compliance. Make sure you do internal audits, you monitor and you test your privacy and security programs, and integrate any privacy complaints and any security incidents, constantly allowing this program to become a force for continuous improvement. So within security risk analysis, there are 3 main things. First is to identify where PHI exists in your practice and how it is created, received, maintained, transmitted, including in your EHR, okay? And types of risks to the ePHI maintained in your EHR, they really will vary depending on whether your EHR is based in your office or whether it is hosted online. Number 2, identify the potential threats and vulnerabilities to PHI. 3 specific areas: human threats, natural threats, and environmental threats. Human threats include cyber attack, theft, or workforce member error. Natural threats such as earthquake, fire, or tornado, and environmental such as pollution or power loss. Vulnerabilities are the flaws or weaknesses that, if exploited by a threat, can result in a security incident or a violation of policies and procedures. So keep that in mind. Third, identify risks and their associated levels of high, medium, and low. That's the next step. This is done by simply assessing the likelihood that the threats will exploit vulnerabilities under the safeguards that you currently have in place, and then by assessing the potential impacts to confidentiality, integrity, and the availability of PHI. So what's the game plan? Well, moving forward, as mentioned, start by having, after you've appointed a compliance officer, have your HIPAA compliance officer assess the potential shortcomings in how the practice protects the patient information, and then discuss those findings and the solutions together, but also include your EHR developer. And of course, keep the documented results of your analysis in a compliance folder. And this can be a great thing to measure where you've come from and to use it for constant analysis. So 2 specific things that I want to say in this regard about a risk analysis. Risk analysis can produce results that can fall into gray areas. It's important, though, to know you will be able to see where you are meeting, not meeting, or exceeding HIPAA requirements at a given point in time with a risk analysis. So take advantage of the flexibility that the HIPAA security rule provides, where it allows you to achieve compliance while taking into account the characteristics of your organization and its environment. That's really key. You're not going to have to do everything that is required by the regulation, because you are your own unique entity. So make sure it's feasible and make sure it's affordable for your practice. And then the next thing I'll say about this, over time, your documentation folder is going to become a tool that, as I mentioned just briefly, it'll help with your security procedures, just helping them become more efficient. And your workforce will also be able to reference this as a master file of security findings, decisions, and actions. And these records can be essential if you're ever audited for HIPAA compliance or an EHR incentive program. So just some tips. I'll just be real brief on some tips for a better security risk analysis if you're already conducting, or if you're in need of knowing where to start. First, educate your staff about the iterative and ongoing nature of the security risk analysis process, so they're not surprised when you're regularly doing it. And then make security a high priority in your workplace culture, which, again, this is what we're discussing. Have an action plan that clearly assigns responsibility for each risk analysis component. Involve your EHR developer, as I mentioned, and ensure the risk analysis is specific to your practice. Okay, so that's just kind of a brief overview of what we've been mentioning. So then some precautions to consider. Some low-cost, highly effective safeguards. The first is to say no to staff requests to take home laptops or any other portable devices that contain unencrypted EPHI. This is a huge problem, and I'll talk more on this in a minute. Remove your hard drives from old computers before you get rid of them. Do not email EPHI unless you know the data is encrypted. Make sure your server is in a room accessible only to authorized staff, and then keep the door locked. Make sure that the entire office is well aware that passwords should not be shared or easy to guess. Next, notify the staff that, again, that you're required to monitor their access randomly, and this will build a lot of trust with them. They won't feel like they're being singled out. Maintain a working fire extinguisher in case of a fire. And then lastly, check your EHR server often in case there is a virus or malware. You want to make sure you can detect and get rid of it quickly. There are constant questions asked about social media by several different practices. And so to ensure you maintain HIPAA compliance, create some policies. The first we would recommend is to access controls, to access controls of your practice's social media pages, meaning keep the login information limited to the minimum necessary staff members. Second is limit or prohibit staff from accessing their personal pages while at work. Third, prohibit your staff from linking personally to a patient's profile page within a social media platform. And the fourth, requesting a signed HIPAA waiver. HIPAA puts the burden of preserving patient privacy squarely on the shoulders of the provider. But an individual can't always waive those rights. So having a simple waiver form that's available for your patients will release the healthcare provider to share patient information for marketing purposes is typically what it's for, and that'll satisfy the necessary documentation. And then, of course, train all members of your staff on the policies and then lead the culture in following the policies and procedures to help protect everyone. So as far as training is concerned, we've talked a little bit about this. Online and in-office training are typically, they're becoming the most popular ways of training. But then you've also got outsourced with consultants. Training in HIPAA privacy and security is mandatory. It needs to be documented and it needs to be ongoing. We mentioned that. So enable your compliance officer to gain a full understanding of all of these rules and allow them time for training to understand their role. Now, employees must also be given, other staff must also be given adequate time to train and understand their responsibilities in EPHI. And as training's completed, make sure it's documented and kept with the other compliance documentation. As far as the three options, it's just important to consider how much time it's going to take to prepare a training course and to train your staff. We recently spoke with an office manager who's in Idaho she mentioned she was trying to develop her own HIPAA compliance training for staff. And she had scheduled a block of time to work on the training, but every time she sat down to write it, she said she was interrupted. And after multiple attempts and several months of clicking snooze on the Outlook calendar reminder, she still had no training course. And in-house training, it can be costly financially and a huge time investment. For practices that are just beginning, if you were to hire a lawyer to prepare a customized program, it could cost somewhere in the neighborhood of $20,000 for a complete program. So that's why a lot of companies are considering online. And at any rate, there are many variables to consider. And even with online, just because it's least expensive, oftentimes people can say, oh, well, I've got account information, login and password for everybody. We just have to go in and do the training. And then all the information's printed out in our setup that creates our policies and procedures. And we've got a manual, and so we're good. But the problem is people get lackadaisical. They think, oh, this is so easy. So they put off the training. And so with online training, the fault is, if you don't set a date and work backwards from it, online training isn't necessarily the best option. So just consider and weigh your options, but know that training is required annually. So more about compliance training, and I'll just be brief. As far as your culture is concerned, this should be an ongoing thing where, again, people that are hired or contracted should go through training, and doctors, nurses, employees, volunteers, trainings, and contractors supporting your office. These should all know how to safeguard patient information in the practice. And so just a few quick things. So yearly retraining, important to consider. Anytime you've got changes in policies and procedures, you'll need to train staff, your systems, location, or infrastructure. or when responding to a breach or a disclosure. And this is actually a really important time to learn as a practice. Oftentimes there was an unconscious incompetency where people didn't know. It's when you don't know what you don't know. and truly, there's so much instructive time that can come after a breach. So anyway, these are a few things to consider with ongoing training within your culture. In addition, we've talked a little bit about documentation. Documentation of risk analysis and HIPAA-related processes, policies, procedures, reports, and activities is a requirement under HIPAA. And then also, it should be mentioned, the Centers for Medicare and Medicaid Services, which they're called CMS, so that's all we'll refer to them. They advise all providers who attest for the HR incentive programs to retain all relevant records that support attestation. So just some examples of records to retain. Make some notes. Your policies and procedures, completed security risk analysis, training materials presented to staff and volunteers, and certificates of completion, current business associate agreements, EHR logs, and those should show both utilization of your security features and efforts to monitor users' actions. And then two more, risk management action plan or other documentation that shows appropriate safeguards, implementation timetables, and implementation security incident and breach information. Now, within policies and procedures, we're going to drill a little bit deeper into this. So with respect to protecting patient and healthcare workers, your policies and procedures, they really are a guide to how your practice operates on a day-to-day basis. Your medical practice policies and procedures should at minimum accomplish the following, and there's 6 things that I'll talk about. First is just to establish the protocols for HIPAA, OSHA, and Medicare. The second is commit to a compliance training program for all new staff when they're hired and on a regular basis for the entire workforce. And we also talked about contractors and volunteers being included. Third is instruct your workforce on what to do when something happens that impairs the availability, integrity, or confidentiality of EPHI or any safety incidents. Fourth, looks like I've already got that up there, specify a sanction policy for the violations of privacy, security, or breach notification rules, or your policies and procedures. So have all of those specified for your practice. And of course, the sanction policy must be applied consistently as it is written. Now, detail enforcement is the next, and that starts with the use of your EHR security audit logs to monitor the access, use, and disclosure of EP, and specify the need for written agreements with business associates that can detail their specific responsibility to comply with the privacy and security. Oftentimes, they may not even be as aware. So make sure you sit down and take time to create that. So now with employee HIPAA, privacy, and security, just a few guidelines. So employees and visitors should wear some sort of identification, badges, a name tag. Next, it's important to speak softly and or use non-public areas when in order to maintain this culture of privacy and security when talking, of course, about PHI. And then only access PHI on a need-to-know basis in order to perform your job. That's pretty simple. And I'll have a story in just a minute that that illustrates one of many circumstances where that has been violated. So need to know basis in order to perform your job, very important. So some simple steps to take at the workstation to promote privacy and security. And there are 5 here. The first is just to keep the documents with PHI out of unauthorized view. Next is PHI should be shredded or disposed of in a secure container. And then workstations and computer monitors, you should actually position them so that they prevent any unauthorized view. Of course, protect user IDs and passwords. And computers automatically return to a login screen by the user when they're not in use. So access, HIPAA privacy and security, controlling access to certain areas in the office, it's going to promote the minimum necessary information that staff is going to have access to. A couple things in this regard, some guidelines. First is to access a computer room. Access to the computer room should be restricted to unauthorized personnel. Backups of PHI are secured in a safe area offsite or not near public areas. Copiers, fax machines, and printers are limited to authorized staff. And lastly, office doors, filing cabinets, and desks are closed and locked when unoccupied. And an alarm should be set for the building after hours. So within environmental HIPAA privacy and security, and again, with all these things that's been said, I believe Benjamin Franklin said, by failing to prepare, you are preparing to fail. So that's why it's important we're reviewing these things. So some guidelines for the environment. When your office is ready for an emergency, the first is smoke detectors and fire extinguishers are operational and accessible. The second is computer equipment plugged into surge protectors, and where appropriate, if you can find an uninterruptible power supply, that's the best. Cybersecurity needed, whether EHR is locally installed or accessed over the internet from a cloud service provider. And then lastly, an action plan for access to the PHI in an emergency situation. If you fail to plan, you plan to fail. So keep that action plan. Okay, OSHA. So we'll do OSHA and then get into Medicare. So OSHA has advised its audit staff that all inspections of hospitals and nursing home facilities, including those promoted by complaints, referrals, or severe injury reports, should all include a review of potential hazards involving musculoskeletal disorders related to patients handling bloodborne pathogens, workplace violence, tuberculosis, and slips, trips, and falls. Be certain to designate work areas and non-work areas. These should, anytime anybody's hired, but also on a annual basis, a reminder of these areas should be brought up in order to avoid any exposure to blood and or potentially infectious materials and cross-contamination. And the last is work area safety, just in regards to, excuse me, this isn't the last, but work area safety, appropriate PPE needs to be worn in these areas where exposure to any blood or OPIM can be. And work areas include all patient treatment areas, labs, sterilization areas, and any hallways connecting these areas. And some activities that you should be mindful that are prohibited in work areas are eating, drinking, smoking, gum chewing, applying any cosmetics or lip balm, taking medicine, or handling contact lenses. All of that does sound pretty common sense. We realize that. We also realize that common sense isn't as common anymore, or so it seems. So non-work area safety. So these areas include staff lounges, kitchens, administrative and or clerical areas, your front office, of course, the reception or waiting room, and any other business-related offices or areas. All contaminated PPE, of course, should be removed before entering any non-working area. And there are no procedures performed in these areas that could result in contamination with blood or OPM. Now, if you train and explain your safety policies to staff and make it easy to comply with these, your culture will definitely improve. And you'll find yourself having to say less and less over time. So OSHA recently fined a New York medical practice almost $45,000 for inadequate worker safeguards. And that was against blood-borne pathogen hazards. The citations included the lack of a written exposure control program outlining the protective measures used to eliminate or minimize the worker's exposure to blood and other potentially infectious materials, the OPIM. And they failed to provide employees properly fitted protective wear and training in its use. They also failed to offer hepatitis B vaccines to at-risk employees. And then lastly, they allowed Sharps containers to overfill and had employees and allowed employees to recap non-engineered contaminated needles. That's a pretty big list. You'd be amazed on how common it is for a practice to have that many nonconformities. So I want to provide a list of the most common violations for medical practices. Again, many of which the New York practice was just recently fined for. And $45,000 is a lot. So I'll go through these pretty quickly. And I'll just read them to you. Don't do that on every slide, but failure to implement and maintain an exposure control plan under the bloodborne pathogen standard. 2, failure to train bloodborne pathogen standard. 3 is the failure to ensure hand washing under the bloodborne pathogen standard. 4, poor housekeeping. 5, failure to implement and maintain a written hazard communication program. 6 is failure to make the Hep B vaccine available. 7, failure to prepare exposure determinations under the BPP standard. 8, failure to use proper PPE. And again, part of that's understanding how to use it, how to use that equipment, protective equipment. 9 is failure to provide post-exposure incident Hep B vaccinations. And 10, failure to train employees under the hazard communication standard. And number 10 is actually seems to be the most common that we hear about. So to avoid noncompliance, regularly do an internal audit of the practice for safety and health hazards, and employee training and periodic refresher training will be very essential for you. Okay, now we'll move into Medicare. Compliance with federal Medicare laws include 7 principles. The first is a distribution of the written standards of conduct, policies, and procedures. In daily work with Medicare and Medicaid patients, strive to be educated in regards to specific areas of potential fraud, such as claims development and submission, code gaming, and financial relationships with other healthcare providers. The second is designation of the compliance officer, compliance committee, and other people, consultants, and groups who are responsible for the different aspects of the Medicare and Medicaid compliance program. 3 is the development and the implementation of a regular education and training program for all employees. 4th, the maintenance of the communication process to receive complaints and the explanation of procedures to protect the complaints and protect whistleblowers from retaliation. And unfortunately, that's a problem. Responses to allegations of improper and illegal activities and the enforcement of disciplinary actions against employees who do violate policies, statutes, regulations, or federal healthcare requirements. The use of audits in the practice and/or evaluation techniques to monitor compliance and assist in the reduction of identified problem areas. And lastly, number 7, the investigation and remediation of identified systematic problems in the development of policies addressing the non-employment or retention of sanctioned individuals. Now, there are specific risk areas to be aware of when maintaining compliance with Medicare. I'm going to go through just a couple. The first is and I'll go through 5 and give you quite a bit of detail on this, and then we'll move into human resources. So the first, as you can see, billing for items or services not actually rendered. Yeah, can you believe that's a problem? No employee should ever bill for an item or service that's not actually rendered. No claim should ever be submitted that represents a service, all or part of which was simply not performed. This is called billing fraud, people. I'm actually not accusing any of you. I'm just the presenter, okay? All right, number 2, providing and billing for medically unnecessary services. No employee will ever bill, should ever bill for medically unnecessary services or knowingly seek reimbursement for a service that is not warranted by the patient's current and documented medical condition. When a claim is submitted, the billing clerk is in essence certifying that the services provided and billed were medically necessary for the health of the patient, and that's in accordance with the orders prescribed by the physician. Duplicate billing. Employees should never submit known duplicate billing to any federal, state, or private agency. And duplicate billing occurs when an employee submits more than one claim for the same service, or the bill is submitted to more than one primary payer at the same time. And sometimes it can occur due to simple error. Knowingly duplicating billing, which is sometimes evidenced by systematic or repeated double billing, can create a liability, though. And that's under criminal, civil, or administrative law, particularly if overpayment isn't refunded promptly. So just keep that in mind. Upcoding. No employee should ever use a billing code that provides a higher payment rate than the billing code that actually reflects the service furnished to the patient. Upcoding is illegal. Don't do it. Unbundling is the last. Employees should never submit bills piecemeal or in fragmented fashion to maximize reimbursement for various tests or procedures that are required to be built together. Okay, we'll be moving on now to human resources. Now, of course, hiring the right person for the right position will save the practice both time and money. When you hire the right employees, it reflects both the person making the hiring decision and the practice. So in addition to feeling welcome and at ease in the new practice, new employees should have three things. First is understanding the policies and procedures through training and instruction, being clear about what's expected in terms of work and behavior, and three, be in a process of becoming socialized into the practice's culture of patient care and safety, and they should be aware that that is a high priority. Now, I-9s are on the rise. I just want to provide just a tip for four things related to I-9. As you may know, the Immigration Reform and Control Act requires every employer to complete and retain I-9 forms. And so here are a few factors to determine the amount of the penalty issued. And I need to surface this just because this is I-9 audits have been really heating up this year. So just a few things to consider. First is whether there's a good faith effort to comply. The second is seriousness of the violation identified through the analysis of the findings. Whether the violation involved undocumented workers. And then, of course, the history of previous violations is also analyzed. So just keep these in mind. These are the things that are being evaluated. Now, I want to talk, we're just about finished here. There are a couple things, and I really did save the best for the last. In developing an action plan, it's important to consider audit preparation. And the Office for Civil Rights, we'll just refer to them as OCR, they say that it makes sense to audit healthcare organizations of all shapes and sizes. And it makes sense. You know, after all, one of the goals of the audit program, it's to spur across the board compliance, okay, with HIPAA, with security and breach notification rules. And the best way to do it is to scrutinize a variety of providers. And virtually any organization that's audited is going to have some HIPAA compliance issues that it has yet to resolve. And so OCR, they urge covered entities to document in advance. Just document any of the areas where you know today you need to work on them. This will give you some flexibility. If you document the areas you know you need to work on and the steps you plan to take, you'll be amazed in the flexibility that provides when you have a discussion with her, should you have a discussion with an auditor. Some of the areas that OCR audit include the following. The first is risk analysis. We've covered that today. The second is evidence of a risk management plan, list of known risks and how they're being dealt with. Next, policies and procedures and descriptions as to how they were implemented. Inventories of business associate agreements and the relevant, and an accounting of where electronic protected health information is stored, how mobile devices and mobile media are secured and tracked, documentation on breach reporting policies and incident responses to policies and procedures, a record of compliance training that has been completed, and evidence of capabilities. Okay, risk management and compliance training are two big ones. that you should circle in your notes. So 5 common circumstances for receiving an audit. Here they are. The first is a disgruntled ex-employee turns you in. They're wanting to get back at their employer. We had a situation where one of our one of the physicians that we've stayed close with for years indicated that one of his employees was very disgruntled when she was fired, and she knew that the doctor hadn't documented as thoroughly, and so she filed a complaint that she had to work all these extra hours, and the doctor couldn't show that. And the short of the story is the doctor was had to pay her, was fined. It ultimately caused so much. This one thing became such a big wedge that he decided to close his doors. So disgruntled ex-employee is huge, and this anyway. Number 2, excuse me, a self-reported breach. And as I've mentioned before, this is actually required by HHS. You're required by law to report your breaches. Employee activists may anonymously contact the OCR, and there's a hotline number for that. Patients' belief that their information has been breached, or they believe someone else's information is in jeopardy. And then the 5th is just a random OCR visit, and we talked a little bit about why that is the case. A couple more things, and we're just about closing up. The U.S. Department of Health and Human Services, they've put together a collection of tips and information to help you protect your health information that you may access, receive, and store on any mobile devices. And that's including smartphones, laptops, or tablets. And so a couple of resources for you. And this presentation, if you want to click on the hyperlinks, if you've already downloaded this on SlideShare, fantastic. You can also find a link below this video afterward with a couple other links that can be resourceful for you. So, quick story. In order to do this, mitigate risk. Learn from this story. Recently, a student healthcare worker, Karen, was fired from the University of Iowa Health Center. What did she do? Well, she violated the privacy of a pregnant female student and her well-known student-athlete boyfriend. Now, for over 14 years, Catherine, she had HIPAA privacy training. She knew better. But that didn't stop her from revealing out loud to at least one that we know of, a coworker, that she just mentioned that she hoped that the young couple was happy with the positive results of a pregnancy test. Thing is, Catherine even went so far as to point out the student athlete to the clerk after she noticed him in the waiting room. She also inappropriately accessed the patient's chart at least twice, opening the records from past visits and medication records. So, the results. Well, the clerk went and spoke with 2 medical assistants who treated the female student and asked about the couple's reaction to the news of the positive pregnancy test. Well, they had training as well, and the medical assistants then reported the inquiry to a manager as a possible privacy violation. So yes, there was a culture of privacy, and my goodness, that could have cost a big fine instead of just firing. It could have cost the Iowa Health Center thousands. And so creating this culture is just so important, and we recommend deliberately creating a culture that emphasizes PHI confidentiality. You can do this in a number of ways. I'm going to mention 5 in closing. The first is speaking often about the importance of trust in the patient-provider relationship. Okay, just remind the workforce that patients expect your practice to be a good steward of their healthcare information. Continually reminding staff to safeguard confidentiality and the security of ePHI. Number 3, make sure your staff has a copy of your policies and procedures for easy reference, and remind them to comply with those policies and procedures. The last 2, addressing staff questions and getting outside resources to help you if you feel you need additional expertise with compliance and message delivery. And the last one is reassessing each workforce member's job functions and enabling or disabling the amount of access they have with patient healthcare information. These are our recommendations. And there's a lot within compliance that we haven't discussed. As I mentioned before, I've given an outline and an overview of many of these regulations, but we have not drilled down as in depth as you'll be required. And so I've got my contact information in front of you. I'll also put some resources in the resources below. I'd encourage you to share this presentation with anybody that you feel could utilize information about creating a culture of privacy and security, as this is one of the biggest issues today with certified entities and with business associates. My name is Lance King. I appreciate your time today. This has been a presentation on creating a culture of compliance.